Master of Ceremonies, and I really want to acknowledge the fact that it is decades. I said no a while ago, and then I had to check, and I was like, yeah, it's 27 years of working in the government. Almost 3 decades. It's terrible. I really need to get another experience, right? I'd like to acknowledge the CEO for the College of Health and Allied Development, Mrs. Carrie-Ann Carnegie, and to acknowledge this amazing work that you're doing. And for the hosting of this conference, it tells me that your heart and your focus is in the right place, because the future is where health must live all the time. I want to also acknowledge you, sir, Dr. the Honorable Rufus Ewing, on your own journey in the public space, the public service space, and public health in general. A long and illustrious his career, and we are very appreciative of the fact that he's a son of the soil, University of the West Indies at Mona. So we're indeed very, very grateful to have this opportunity to reflect on what I believe to be a very powerful theme going into the 21st century. Let me first apologize for my minister, Dr. the Honorable Christopher Tufton, who is attending another function and expresses his deep regret that he's not here to share with you. However, I myself am extremely pleased to be here and consider it a distinct pleasure to have this opportunity to speak on his behalf at this conference. Ladies and gentlemen, the title of this conference, Reviving Healthcare, Reimagining Healthcare Innovations and Solutions for a Healthier Future, is not only timely, but it is apropos as it highlights critical points for transformation, both in health and in the wider public sector. Friends, the Ministry of Health and Wellness, and indeed the entire public sector, is at a peculiar time and an interesting dispensation. In former years, our efforts to reform and transform health were often stymied by lack of funds. Fiscal space and fiscal resources could easily be cited as reasons for underperformance of the state on critical projects and programs. It was a safe default response and would be understood and even accommodated as an excuse by the wider public, as everyone understood the vagrancies of poverty. After all, it takes cash to care. Friends, today we are at a different space and a different dispensation, where because of our collective fiscal responsibilities and the sacrifice of every Jamaican, we are at a significant point where resource availability allow us to do more. Thus, the ability for the bureaucracy to respond with our usual default of no cash to care is now less potent and represents a reduced effort to serve the publics that we have. This brings us squarely to the substance of the theme for which this conference has been laid, and why this theme for us in government is particularly poignant, because this theme points us to the new order, a new dispensation of creating a Jamaica where persons can live, work, raise families, and do business. That substance in this theme surrounds culture change. Ladies and gentlemen, within the health space, and particular the health space that has to do with digitization, the culture and dynamics of health are moving into agile and more responsive service delivery. Persons within this space are high dopamine consumers who live thrill-seeking lives in a world of constant innovation and change. In this world, finding and bringing new products to market, new innovations, is a hallmark of a culture where yesterday's technology is to today's archaic approach to delivering services. On the other side of the dispensation, colleagues, the other spectrum, we have the state apparatus, the bureaucracy, that sees this agile environment, that sees this need for change as a disruption to the status quo. And oh, how we civil servants love the status quo. Agility for us is not a nice word. It represents a true and present risk that we must manage in the civil service. Now, some may think that this is a bad thing. Why is the civil service like this? But it is not. Ladies and gentlemen, the bureaucracy that we practice in Jamaica has significant elements of colonial retention. But these retentions are essential to the democracy that we also practice. The systems that we use to manage a state as the bureaucracy is the system that sees us as the arbiters of the social contract. And this contract, this social contract, prizes consensus and consultation, both of which require time. And therefore, this is a gravamen of the tension within the theme that you have proposed. Because latent within the theme is the massive culture change that must be addressed if we are to attain this lofty ideal of reimagining healthcare innovations and solutions for our healthier future. How do we, as a civil service or as a bureaucracy, become more agile while still safeguarding the tenets of the social contract? What is the balance that we must establish in ensuring the public good, the informed interest of the population, and the need for innovation and agility? Let me present you with a live example of what I am talking about. As you may be aware, the Ministry of Health and Wellness has begun the process of implementing an electronic health record system in our public hospitals. And we have already retrofitted and launched within the Mapen Hospital the electronic health record system. And immediately, the benefit of the system is clear. The senior medical officer at that hospital, in one meeting, could clearly see where are his needs, based on the number of patients he saw in his report in terms of admissions. So immediately he saw that he needed to right-size his hospital. He needs to redeploy beds. He needs to redeploy staff. He needs to engage more technical services in specific areas because the service demand from the population that he serves in that hospital required a rethink. Innovation at work because of technology. However, Balance that experience with the new requirements of the Data Protection Act that defines and mandates specific requirements for medical records. A key feature of the new legislation is informed consent. Now, the bureaucracy needs to respond in a way that provides the patient with the assurances of the law. Advising the patient that the record is no longer being stored in the hospital. It's not owned and you can't pull it up and it's not in a file jacket somewhere. It's in a server somewhere in cyberspace where it can be reached by anyone. Anyone. The stories coming out of the United States and United Kingdom of entire hospital systems being closed down because there has been data breaches and data captures and different malfeasance with data that cause the entire service delivery to be undermined because the data was totally restricted and a ransom was demanded. How do we protect? How do we manage with the agility of the new EHR system versus the conundrum of legislation and regulation? And that's the tension in your theme. How do we create a space that not only actions and become agile and become creative and innovative, but also protects the rights and privileges of the Jamaican citizen? It is not for this conference, however, to focus on problems. It must be solution-oriented. A problem-focused conference serves no good to anyone. And therefore, solution orientation is where I believe the theme tells me that you will be going. And therefore, we in the public service are waiting on the ingredients that you will provide for the cake that we shall consume. There are three key points that I would want to offer to you in your considerations, therefore, in terms of bringing us to that very important middle point of the conversation between innovation and the bureaucracy. Firstly, I want you to understand and appreciate that the government matters. A lot of times we see the government as bottleneck and roadblocks and instruments of regress and not progress. But we matter. And therefore, we have to be a part of your conversation for solution. And therefore, as purveyors of innovation, we want to tell this conference and encourage you that the government is one of your largest and most important colleagues and stakeholder. Thank you. Friends, in my ministry alone, over the next 3 years, we will be spending $35 million on ICT innovation in health. You already know about the investment that we have made in the EHR. However, we have a contract with Cable and Wireless for the retrofitting of about 103 health centers across the island to support the build-out of electronic health system. We will be launching our call for proposal for electronic immunization register. All I'm saying is that we have the cash to care. And we have the cash to care, but we need your support and collaboration. We cannot do it alone. However, many private sector partners, many tech companies tend to shy away from working with government. The bureaucracy is just too insurmountable. And when they do the risk assessment, they determine that it isn't worth the while. But I want to tell you, it is worth the while. It is worth the while to invest with a stakeholder that is consistent in terms of our charge to innovation. I therefore wish to use this opportunity to encourage your colleagues to look out for the opportunities for collaboration with the government. Spend time, invest resources in understanding the bureaucracy, because we must manage consensus and consultation in arriving at the good balance of the social contract. Procurement is not a horrible thing if you understand how to navigate its rooms and corridors. The second point I wish to point, or the second point that I wish to raise, is the need for active advocacy from persons like yourselves. Change is not a bad thing, but the bureaucracy is not given to change. Change must be hard-won through advocacy. And therefore, it is within this context, within the area of academia, within the area of health service delivery, within the area of training and development, that we ask that an investment in advocacy be done. Come to the table, raise the issues of change, instruct and engage with the different players in the area of advocacy so that we can arrive at a place that is beneficial not only to the civil service, but to the wider Jamaica. In doing so, I ask you to answer the following questions. What type of advocacy do we need to reimagine healthcare? What type of actions are required to create the laws and regulations to support the innovations that we seek? What are the idea spaces, like this one, that need to be created where solutions can be crafted? Ladies and gentlemen, the answers to these questions are in this country, and I dare to say, are in this room. If we are reimagining healthcare innovations and solutions for a healthier future, there's a boldness that is required. There's a tenacity that is required. There's a need to kick against the grain. There's a cœur de lion, or a lion heart, that is required by all stakeholders. Advocacy is key. And lastly, we need research. Research is the hallmark of evidence-based policy and programs. And within this context, we have to ensure that we invest heavily in our research agenda, building out the capacity within institutions like yours and through conferences like this, where research is fostered and encouraged, nurtured to grow. Ladies and gentlemen, the Ministry of Health and Wellness is ready to collaborate. Over the next 5 years, we'll be investing significant resources in structuring the healthcare system. And notice I say 5 years because I do not have a political life. So I can vision beyond the next election. So over the next 5 years, there's a lot to be done. The reforms are many. The structures and the structural changes that we have to make are many. We need all hands on deck. Ladies and gentlemen, Jamaica is at a pivot point. After over 60 years of independence, we are at a crossroads that need us to shake the apple cart and do radical things to create a Jamaica that we want. The health system is part of this transformation, and we at the Ministry of Health and Wellness understand that we must change or perish. However, this change must be facilitated through our mutual understanding of our different roles in the society, our mutual respect for our part in the division of labor, and our function in the social contract. It is my view, and I believe that of my minister, that this conference with its theme, Reimagining Healthcare Innovations and Solutions for a Healthier Future, can only help bring us closer to attaining our mission of creating a Jamaica where we live, work, raise families, and do business. I thank you for allowing me this opportunity to share and wish for you a very successful rest of conference. Thank you very much.